Have you ever wondered why some people recover faster than others after having a joint replacement? After treating hundreds of hip, knee, and shoulder joint replacements, I actually found three similarities that these patients all share that aren't just attributed just to their genetics or having good luck in terms of their recovery speed, but it's actually attributed to things that are repeatable and that can be implemented in future recovery when you're having a joint replacement. The first similarity that all these patients share is they participated in some sort of physical therapy or prehab before they went into their surgery. So, what that exactly means is before they had their surgery, they either went to outpatient physical therapy clinic, which is the most common, or they did some sort of home health or home routine program where they were given specific exercises to work on by a medical professional or a physical therapist, where they worked on pain-free exercises as much as possible just so that they can build a better foundation. So naturally, when you have surgery, you're going to lose a percentage of your strength at whichever joint you're having that procedure on. So the more strength and the better your ability is to contract certain muscles before you go into surgery, you're going to have a little bit more of a gas tank that's essentially higher compared to if you don't go into the surgery with any strengthening and exercise. Your gas tank is starting from a lower percentage. So naturally, whether you exercise or not before surgery, you're going to lose strength, but you want to have a higher threshold of that gas tank or a high threshold of strength so that when you inevitably lose some strength, your essentially your gas tank is higher to where you have a good amount of muscle function and strength compared to if you started, with less strength and you lost that same percentage of strength after the surgery. You're going to be trying to fight an uphill battle where doing certain movements, certain exercises, really just trying to move that limb that you had surgery is going to be much tougher because you're just going to be weaker. So the better that you increase that gas tank, increase the threshold of strength that you have before the surgery, your outcome after the surgery and your recovery is going to be faster because you had more strength to start off with. The second similarity that all these patients share is they are very good at consistently doing their home exercise program. So regardless of the stage of rehab or recovery that you're in after the surgery, you're going to be assigned specific exercises according to the timeline that is safe for you to perform. Now, especially in the early stages, so that first 2 weeks after surgery, that's when typically you're going to be experiencing most of the pain, regardless if it's your hip, knee, or shoulder. That first 2 weeks, maybe even up to 4 weeks, but especially the first 2 weeks, you're going to have a lot of pain, discomfort, and swelling. Now, this is where individuals often fail to continue being consistent with their home exercise program, but the ones who recover the fastest, they still do their home exercise program, even if it's a modified version. So for example, let's say if we're talking about a patient who had a knee replacement and they have to work on trying to bend their knee. Now, once you try to bend your knee after a hip replacement, once you get further and further, you're going to have some pain in the knee joint, even around the knee joint. However, when patients typically experience that first pain when they're trying to bend their knee, sometimes it'll scare them, but the main thing is they don't want to experience too much pain, which is very understandable, right? But just because you're having pain doesn't mean that you have to stop doing all your exercises or this exercise specifically. What the ones who are typically more successful do is they modify it, especially with the instruction of the physical therapist. Typically, we'll tell the patient, hey, try to bend the knee, but only work in a range that the pain is maybe anywhere from a 1 to a 4, maybe 5 out of 10. But the closer we have you to that 1 to 4, the lower levels of pain, then you're going to be able to tolerate exercise better and also have less swelling and inflammation. So if you force yourself in a range or to do exercise that is too painful, then one, you might cause more harm than good. Two, you're not going to want to keep doing the exercise because it's going to be too painful. So instead of just stopping the exercises that you're assigned, try modifying the exercise. Typically, your patient will tell you, all right, and if this hurts, do it in a different way, do it this specific way, which should give you a little more relief and have less pain. But one of the things you do want to try to avoid is just stopping your exercises completely. If you have any questions, it's always best practice to ask and confer with your physical therapist to see if there is a way that you can adjust or modify the exercise so that it feels better. But the second similarity is really just finding ways to be consistent with your home exercise program. So not only does this apply to the first 2 weeks, but even 2 months after surgery, you still want to be consistent with doing your home exercise program. The third similarity is that these patients who all recover faster, they're very in tune with their pain levels and their body, and they do a great job of listening to their body when they're having pain. So whether you're doing exercises, if you had a hip and knee replacement and you're standing and walking, if you have discomfort with that, these patients are very good at acknowledging that pain and modifying the rest of their day according to that pain in terms of what they're going to continue to work on, how much they're going to work on the exercise and movements, etc. So first, you should understand 0 out of 10 pain scale. 0, you have no pain at all. 10 out of 10 is take me to the hospital right now. Some people will say that they have very high pain tolerance, and I hear that almost every day when it comes to a brand new patient who had a joint replacement. Now, in the first 2 weeks, especially the early stages after joint replacement, the concept of no pain, no gain does not apply here. You really want to listen to your body, because with these joint replacements, if you do too much too soon and that joint and those structures around the joint are not ready for what you're trying to push your body through, one, you can cause the joint to fail, you can cause possible dislocation, and you're going to require a revision with surgical repair, because you can undo the joint. You can damage that area further if you do too much too soon, or if you break the precautions that your surgeon or your orthopedic surgeon gave you. So making sure that you're within the safe precautions, you're doing what you're supposed to do and what you're allowed to do. And now you just want to prioritize when we're talking about quicker recovery, prioritize what your body is telling you. So let's say if you're doing some of your exercises that you're prescribed by your physical therapist, and the first couple of repetitions that you're doing a certain exercise for, you feel okay, you have 2 out of 10 pain, but as you get closer to 7, 8 repetitions, now you're starting to have 7 out of 10 pain. At that point, that's your sign that it's time to stop that exercise and take a break. If you're given a specific number of, let's say, do 10 to 20 reps of a specific movement or exercise, you don't want to just push through a 7 out of 10 pain just to finish out your exercise. You want to listen to your body and respond accordingly. So if you hit past 5 out of 10 in terms of your pain, that's where you're stopping, and then you continue that exercise maybe later in the day. But if you just push past it, you're only going to cause more pain and inflammation and possibly more swelling at the joint, which in general, the more inflammation and swelling you have, that's going to delay your healing. It's going to delay the tissue healing, and it's going to prolong your recovery, because the more swelling you have at that joint, it's going to inhibit some of the muscles. It's going to cause the muscles to be less effective, which now that adds more time to your recovery, because it's going to be harder for those muscles to wake up and do their normal job like they're supposed to. They're not going to be as effective in working. So the last similarity, really just focus on listening to your body. If you have a significant amount of pain, more than 5 out of 10 pain, then try to dial things back, modify some of the exercises. A lot of the physical therapists that you'll work with will typically give you options or specific adjustments to make for certain exercises if you have difficulty. But if you're ever in doubt, always try to confer and discuss with your PT to find ways that you can modify exercise if it's too painful. But the main thing is you really have to watch out and listen to your body when it comes to movement and exercise.